Hey, everybody. I'm here with Yusef and Keyur, the founders of Roger Healthcare. Hey, guys. Thanks for joining me.
Thanks
Thanks
for
so
having
much for
us.
having us.
So tell me a little bit about what Roger Healthcare does.
Yeah, absolutely. Yeah, so what we do at Roger Healthcare right now is we build a mobile app that home health clinicians can use to record their patient conversations and then give them feedback on items that they haven't got covered. So it basically navigates them throughout the visit. So if they didn't talk about the diabetic status, it would tell them, hey, by the way, you didn't address it. Please address it with the patient. And then it takes all this information and fills out the medical record for them. And right now, we are saving clinicians more than 80% of the time that they usually spend on documentation.
That's awesome. Tell me a little bit about the founding story. Why'd you guys decide to start the company?
Yeah, absolutely. It's actually Keyur, me, and another co-founder, Eunice. We were roommates at Cornell. So we actually chose to become roommates just because we were all interested in entrepreneurship. So we interviewed each other and were like all very hyped that we are interested about it. And yeah, so throughout the school year, we were thinking about a lot of problems and like ideas that we can use for our own startup that we can build. And yes, through personal experience, we all have like some sort of connection with healthcare. My sister has been a nurse for over 13 years. So I actually know firsthand that clinical documentation can be really painful. You do it at night, on weekends. So that's why we wanted to actually tackle this big problem and landed together on home health, where we saw the biggest need and the biggest, like the highest regulations and the largest documentation. And yeah, so we came together after school, got funded by Berkeley Skydeck, and then kicked our journey off directly from there.
So why now? Like, why is this company able to be produced right now compared to 5-7 years ago or whatever?
Yeah, absolutely. So the interesting part about now is like it's two parts, one from the technical perspective and one from the essentially from the demographic, like from the market perspective. So when it comes to the market, it's very interesting that now in the next 10 years, the home health market is going to double. And this is just because of the trend of more older adults that need care. And this basically makes a problem for those home healthcare organizations. So they have to deny a bunch of patients and they just don't have enough capacity to serve all of them. So right now they're denying more than 45% of the patients that they get referred to just because they don't have enough nurses. And that's the big problem. So that's why now we need tools and technology to make nurses more effective and productive to take on more patients and serve all the elderly. Now, from a technical perspective, now is the time with the new wave of AI where we can actually really save a bunch of time in terms of like really recording conversations, making sense of that, giving like being a co-pilot for you, and then be like just next better than years before.
What's really interesting too when it comes to the home-based care setting is how onerous this whole documentation problem is, especially. So you have for every new patient that you see multiple hours of paperwork that you have to fill out sometimes, spanning hundreds or even 1,000 questions of very, very literal fact-based things. Does this person have diabetes? Okay, what type of diabetes? How often do they have to administer their insulin? Can they do it or does their family have to do it for them? So it's the kind of thing where really nurses are just spending hours, and the problem is the most difficult version of the problem that you can imagine, which is partly why it really resisted solving until our team came around.
Awesome. Can you guys paint me a picture of kind of where you guys are right now? You mentioned that you had some funding from Berkeley Skydeck. Like, what does the team look like? What is the next big milestones that you're trying to move towards in the next year or two?
Yeah, absolutely. We are a team of 6 people right now. So it's mostly focused on engineering. Yeah. So right now, in terms of product, our product is live. Right now with around 10,000 visits per month that we process, and we are basically rapidly expanding that and building new features onto our platform. Especially now with new regulations, there are new quality assurance items that we have to make sure to address on top of that. And in a year or two, we hope to really like grow to 10 million in revenue and really become like a really, really robust product with a bunch of features that those customers really need. And it's not only documentation that those customers are interested in, there are a bunch of other human work that is involved, which is related to something like scheduling and intake and other pieces. So there are like a couple other pieces that we are putting on top of that.
What's the big risk between now and 10 million? Like, what do you guys need to prove out to kind of make sure that you get there?
Yeah, absolutely. So basically, it is really interesting that we have to do those EMR integrations. So, and this is a bunch of custom and technical effort that we have to put in. And now it's about making that very robust and serving those EHRs that really serve most of the market. And that's where we are right now on. So with one of them, we are very robust. Now it's like just adding more on top.
The good thing is that we feel very constrained by engineering bandwidth, so we have the customers kind of knocking down the doors, and we're not able to serve them as fast as they would like in terms of ramping up new customers and adding those new features that they've been screaming for, basically. And that's why, as part of the latest funding round, we were looking to really grow that team and go out there and seize the day.
So you guys are hiring engineers. What is your pitch to them? Like, why should they join Roger Healthcare? Why is it a great place to work?
That's a totally great question. I think of it in two parts. So if you're someone who's looking at an opportunity at a really early stage company, like where we are, where other companies are, there are two things that I think you're looking for. This is what I was looking for when I left my big company life to kind of come to the startup world. On the one hand, you want a mission that you can believe in. And on top of that, a belief that you and your team can beat all the odds and actually go out there and do the damn thing. And then on top of that, you want a lot of opportunity and greenfield where you can come in and make a big contribution and not be just a cog in the wheel of a giant machine. So we are really at the intersection of that in the perfect way at this exact moment in time, I feel. And that's because on the one hand, the core documentation wedge product that's gotten us this far, it's really taken off into the kind of exponential growth curve that you hope to see, where we're now adding new customers all the time and in the top handful of startups by revenue growth in total. But on the other hand, because we're now building some extra value-added features that come beyond that, there's all this room for an engineer to come in or whoever to come in and make a stamp on building 0 to 1, like a completely new product line, new revenue, things like that. So there's still room to go out there and do something new with the kind of stability and belief that the core product is off to the races.
That's awesome. Talk to me a little bit about how you all work. Like, how do you go from an idea to kind of a ship product or ship feature, I guess?
That's a good question. What I think we're pretty good at is staying very close to the customer, which is, when it comes to B2B enterprise sales, where technically, like at the end of the day, you have to convince the decision maker who's 10 levels up, who's the CEO, who gets pitched all the time. It's very easy to overfit to just making the sell and doing what, wearing a nice suit and making a nice pitch deck and doing whatever will close one deal. But luckily, through some good mentorship that we've got in our lives, we kind of realized early on that that's not the way to sustainable growth. That's going to take you all the way that you want to go. So all of our products really come from ground up, talking to clinicians first, making sure that the individual clinician actually believes in and like understands the value and agrees with us that the value is there. And then we figure out how to package that into something that the decision maker will pay for, instead of starting with the decision maker. And I think what this has really allowed us to do well is, if we can figure out how to build the business case around the value that the clinician clearly understands, it's very easy to keep making sales now, because at the end of the day, we know that the product is actually helping the user.
Does working in a space like healthcare with a lot of regulations change the way you guys have to build product?
It does, yeah. So there are basically constant regulations to, like, constant changes to the actual forms, how documentation is done. Even now, January 1st, one of the main forms that we are working with is changing as well. So we have to be constantly aware of those changes. We have to stay up to date, and that's where we are. So it's good that we have such a close relationship to our customers. So actually, 2 of them even invested in us. So, which I guess is a good sign. So they really believe in our vision and are just like there as our mentors, and we try to leverage that to really appeal to the rest of the whole market.
Makes sense. Talk to me a little bit about the team itself. Like, I'd love to hear about your guys' backgrounds and the backgrounds of like the 6 people that work there.
Yeah, absolutely. So yeah, maybe I can just start. I'm actually born and raised in Germany. I had a background in mechanical engineering and made the switch to technology. So was very interested in startups, wanted to come to the US and actually build my own one. And so basically broke into tech through doing a CS degree at Cornell, and met basically Keyur and Yunus there as my co-founders, and just dove directly into it. That's on my side. Keyur, you can go.
Sure. And for me, I first learned to code many years ago through kind of math and little coding challenges and competitions and things like that. And then I got a bit better through robotics in high school, and then did my degree in CS. But I also got really interested in business through the strategy consulting club in my undergrad too. So that was really cool because as someone with like really CS fundamentals, to now bring a bit of business into it as well, I felt like it positioned me really well for entrepreneurship in the future. And then towards the specific pain point, when we realized that this is what we wanted to work on, basically 3 of my 4 grandparents during COVID all caught COVID or various other conditions and ended up passing away. But during that time, they had a mix of both home-based care and inpatient care in various facilities. And I really got to see the quality difference in outcomes when you have the best version of care in the home, where the caregiver really cares and allows you to stay in your community, and also the worst version where they're constantly on their phone or paperwork doing documentation and don't even pay like individualized attention to the patient, which was my grandparents. So that kind of brought me in and got me hooked on the mission as well.
That's really tough. Was that a big part of deciding to start this company? That experience?
At the time, it's a pretty emotional moment. At the time when, after the second grandparent had passed away, and we were in the ideating stage, but actually on a different idea, I remember having the thought that like, somehow what I'm going to do, I'm going to dedicate it to you, basically. And then it became the cherry on top that in a roundabout way, we actually ended up serving elder healthcare as well. But whatever we had done, it would have been dedicated in that way.
And it's also very interesting that we had close to our campus, just like in walking distance, senior facility. And we actually went there, like, I think the last semester, like very often, just to be close to the pain points, to be close to what is actually a problem there. And we came in with the population and the vulnerable population first, and then basically got from there to the pain point that really makes it harder for them getting quality care.
So talk to me a little bit about the culture that you all are trying to build at Roger Healthcare. Like, how do you all want to work? Like, what are the values that you want to see in the people that work there? What are the behaviors that you want to see in people that work there?
Totally, yeah. So it feels to me a little bit like a training camp for the Olympics or something. So on the one hand, you have people that are really, really devoted to a mission that make that the central focus of their lives almost. On the other hand, you have this real feeling of like camaraderie and brotherhood between everyone, that you're all competing for the same country, you're sort of cheering on each other's accomplishments. And at the same time, there's a bit of undertone of like friendly competitiveness where you push each other day to day, but really it's us against an insurmountable challenge that we're somehow, think that we might actually be able to solve. So yeah, that's the best analog for how it feels to me.
Yeah, I think that captures very well. In general, when it comes to core values, so we really believe in high quality, and we push ourselves, like we're constantly in touch and give us each other like a lot of feedback sessions to improve even our personal growth. So even as individuals, and I think even for anyone who will join us, this is very important, and just to really set them up for becoming really like getting really high quality work done. And and in general, we have a high responsibility to our customers. So, and we believe this is one of those things that we really strive for.
What does that high quality mean to you? Like, what is, practically, what does that look like? Maybe give me an example.
I was just talking to a friend about this. It's related in a roundabout way to what you're asking, I think. So I was just talking to a friend about this, and it made me realize that we have, on the one hand, we're like very willing to kind of forgive mistakes that came with good intentions. So for example, like in engineering, if you did all the right controls and then you push something to production and the system went down, there's not really a culture of like beating each other up. But then on the flip side, there's really a culture of figuring out why did this happen? What can we do in the future? Or let's say we had a product launch or a demo and it didn't go well. There's really no culture of beating each other up. Oh man, that was your fault. That was my fault. Why did this go wrong? But it's going to kill us. It's going to keep us up all night, all week, if we can't look back and figure out what went wrong, why, like, well, how are we going to improve the next demo? And so in any given moment, it might not feel like it. You might be at a low point, but if we just keep making those kind of improvements and keep figuring out why, over time we just start to really perform at a high level and make decisions that have a lot of logic behind them.
What are some of the key traits you look for, or maybe the number one key trait that you look for when you're looking to make a hire, or that potentially predicts success at your company?
I think in some of the examples of great performance and some of the great performers we have on our team, I've seen them really fixate on a problem. So it's like you're exposed to this problem and you don't know exactly how you're going to solve it, but it just bothers you, man. It just bothers you, and you can't rest until you figure it out. And sometimes you even surprise yourself with how you're able to like pull it out of you in unexpected ways and come to a solution. But certainly a culture of, while you're making your coffee, while you're in the shower, while you're walking around the day, the problem is somewhere circulating in the back of your head, and then the solution pops out eventually.
How do you all interview? What does the interview process look like to kind of figure out if someone has these traits that you're looking for?
So normally what we do when it comes to interviewing, we try to keep the flow similar to how the job will be. So instead of very abstract interview questions, when it comes to engineering at least, that are not that reflective of the day-to-day work, we try to design all of our interview questions basically based on actual code and customer scenarios that really happened in our company. So we'll take like part of our code base and just kind of rip out the guts of the code, and that's what you solve during the interview basically, is completing that kind of feature. And similar when it comes to other types of hiring outside of engineering, work samples that are very aligned with real work we had to do, like making a mock training session for a nurse or making materials to hook an agency during a demo, stuff like that. And then the other thing is we just want to get a well-rounded opinion of a person. So trying to make sure that they get to meet multiple different people in the company once, and even having an on-site component at the end so that we can see that the team chemistry is really good and everyone's basically having fun and could see themselves becoming friends with the rest of the team.
And are you guys based on site? What is the remote, hybrid? How does that structure look like right now?
Yeah, it is on-site San Francisco hybrid.
So what would surprise people about working at Roger Healthcare, or maybe just working in the healthcare industry or health tech startup space in general?
I think one of the things would be really how old this industry actually is in terms of technology and advancements. So I can tell you, one of our customers, they don't serve so many patients, so they're pretty small. You can say mom and pop shop. They spend around $5,000 in fax costs a month. So
that's wild, yeah.
That's usually something where people become shocked and say like, okay, how is this still possible in 2024? And there are a bunch of things like that throughout the day where there's a lot of manual work that you just can't imagine is happening today.
Can you actually, that's interesting, right? Because you have kind of a very old, very stuck in their ways potential industry with a lot of regulation and stuff. So how do you guys get through to an industry like that? Are they open to all this stuff, or how it seems like obviously you guys are making progress. So what's working here to kind of get people off these old systems?
Yeah, it is very interesting because throughout the last decade, there were always technology companies that are trying to help those and target those folks. But the problem, one of the problems is the market is very fragmented. And there's a bunch of custom work that you have to do for certain agencies because they're just operated in a different way. Now, the thing is, what didn't make the bar was actually the time save that really was there for the clinicians. So in general, getting adoption with clinicians in this space is really tough. Now, to make it worth to them, it has to really be fit very well into their workflow, and they shouldn't do any extra step or click or anything like that. And that's where the system has to be designed really in the right way for that. Those integrations that we had to make with existing medical record systems were huge time suck, and also technology-wise really hard as well. So this is where a lot of people get scared away just because there's so much friction to even get to this point.
Awesome. Well, thanks, guys. This is awesome. Thanks, Keyur. Thanks, Yusef. If people want to learn more about Roger Healthcare, where should they go?
RogerHealthcare.com.
Awesome. All right. Thanks, guys.